I said, by the time infection gets here, one or two things are going to happen. So I'm using morphine because I have too many wounded. I know I'm going to run out of them. And I said, in fact, I got to keep the ones that can get up and keep walking so they don't have to be carried. So what I did was I gave each one about maybe a third of the syringe, enough to keep the pain down so it wasn't going away and they weren't so foggy they couldn't walk or couldn't respond to your instruction. But it dulled the pain enough where it was tolerable. And so I would hit 3 people with one syringe. Well, he said, did you use alcohol cotton swabs? No, I just shoved it in their arm right through their uniform. He said, weren't you worried about infection? I said, no. I said, infection. I said, by the time infection gets here, one or two things are going to happen. We're either going to be out of here and we're being in a evac hospital someplace, or we're all going to be dead. So I'm not worried that, it's not, those are your 2 options, So, I mean, that's what I did. And I also stopped doing proper bandaging procedures because I found that when you start trying to change the bandage like you're supposed to, you just start the bleeding all over. So what I did was I just kept packing bandages in till the blood stopped. You make do with what you have to do.